Is there one or more physical stockpile of supplies?
Absolutely. So, Cassie, we've had about 74 million sets of masks that the state has bought and distributed across Texas. We have an additional 43 million in inventory, and that doesn't count the 49 million that our federal partners and FEMA have already put into the private supply chain. Now, trying to make sure that our inventory is closer to need, we have our current inventory dispersed into 8 different locations across the state.
All right, good deal. And do you normally keep this level of supplies?
So we have not had this level of supply before. I think it's important to realize right now that the amount of inventory that the state has just in its own warehouses has exceeded anything that we've ever held in the past. Even in past disasters like H1N1 or the Ebola response, we've never had this kind of PPE in stores ready to be distributed to our local partners.
Where are you getting replacement supplies from as these go out?
So we all remember how short supply the supply chain was, and we searched all over really the world. The Governor Abbott strike team for supplies and PPE did a great start in reaching out to non-traditional suppliers. We had a very good vetting process to make sure that we got quality materials in. And right now, as our federal partners in the FEMA Air Bridge has been bringing supplies in, we see our normal distribution channel starting to fill back up.
What places in Texas may need the most supplies?
So I think that's going to be a little bit of a difficult question to answer. Really, some local jurisdictions and governments and healthcare systems are also buying their own PPE and bringing them back up. Our goal will be that local government and the first responders manage their own PPE and their own inventory by themselves through their normal supply chain. Our job is to be that backstop or that back gap to filler if they can't find that PPE, or if we have surge where we need additional PPE. We're not the frontline sellers of it. Our job is to get it and make sure that everybody has enough if they can't get it on their own.
Sure. Now, we've received a lot of questions about masks. How effective are masks and what type is preferred?
So first of all, any face covering is better than no face covering. There are great surgical grade and medical grade N95 masks that a lot of the healthcare providers are still trying to make sure that they're using. But for the rest of us that are just walking around the street, any 3-ply mask or surgical mask or cotton mask. Really the goal here, if I'm wearing a mask, I'm protecting you from me. And as we get out there and the public needs to be wearing more masks, that's the face coverings that we're looking for. Whether it's cotton or paper is not as important as the fact that you are actually wearing a mask.
Sure. As the state continues to reopen, I know there was a pause today that the governor announced, but as the state reopens, what are the possible consequences of non-compliance at bars and restaurants?
So I think we've already seen across the state in several locations that the Texas Alcoholic Beverage Commission has suspended license for bars that are not in compliance with the governor's order. You know, our goal all together as one state should be to reinforce safe practices. We do want to reopen the state, but we want to do it safely and we want to do it methodically. We also need to keep increasing enforcement. After our graduations and a lot of parties, we saw people come together, maybe even in their own homes, that just didn't practice, safe practices as far as spreading this disease go. So our goal, safe practices, effective enforcement, and keep surging testing.
For sure. Compared to other regions, do you think the Texas Panhandle is prepared should we see an uptick in cases?
I think the Texas Panhandle has done a very remarkable job in responding to this. All around Amarillo, when we worked with your mayor and your county judge on the meatpacking plants and really been able to stabilize that, the mobile testing teams that Governor Abbott sent into the area helped stabilize that, and you've done a remarkable job, but we're not done. We need to keep making sure that we are social distancing and we're following all the recommendations from the doctors.
Absolutely. Is there anything you want Texans to know about testing in Texas right now?
So we want you to know that there are about 890 testing sites open across the state. There's more than a half a dozen just in the Amarillo area. If you feel like you need a COVID-19 test, we want you to talk to your doctor first. And if your doctor recommends that, we absolutely want you to get that. There are testing supplies out there. We do not have a shortage of testing supplies, and we do not have a shortage of lab capacity. What we have right now is people not necessarily following the rules that they've been asked to follow. And so testing is available, but please reinforce the message: social distancing. Don't get out if you don't need to get out. Don't need to be interacting with people if it's not absolutely necessary. And if you are in public, maintain 6 feet from each other and cover your face with a mask.
For sure. And I believe the governor announced it yesterday, but you guys are actually collaborating to give out free masks at state-run testing sites. Is that correct?
Yes, ma'am, it is. Our goal, if you're coming into one of our state facilities or our mobile testing teams, like you've had many in Amarillo, will be to issue masks out to anybody that does not have masks. We'll go up to 4 masks per person being tested. There should be no reason that anybody can't wear a mask.
All right. Is there anything I didn't ask you that you'd like the people of the Panhandle to know?
No, y'all are doing a great job, Cassie. Thank you very much.
Thank you so much for speaking with us today. We appreciate it.
Yes, ma'am. Take care.